Awesome. So, yeah, that's our topic for today, designing recognition and reward systems that reduce healthcare turnover. Quick couple of housekeeping items here. If we haven't met before, hello, my name's Rebecca and I'll be hosting this session for you today. Just a few little housekeeping items here. We are doing this session as a roundtable format. This is the second time we've been trying this format. It's been really wonderful having all the different voices in the mix, including the audience. So please don't be shy. Would love to hear from you. The idea is that we do have a list of questions that I've sent out prior during over email. The panelists will kick things off by answering the questions, and then we'll open it up for the floor for you to jump in with your own perspectives, your experiences, or just any follow-up thoughts. And so if you would like to unmute, you can raise your hand with the Zoom raise hand function, and then Kaylee will call on you and I will unmute you. But of course, if you rather contribute in chat, please feel free to do that as well. Kaylee and the panel will be keeping an eye on it and just weaving as many insights into the conversation where possible. Yeah, so we really just want this to feel like a conversation, not just a panel. So we would love it for y'all to chime in. The chat box feature is open. Make sure your blue drop down is selected to everyone so that everyone can see what you're saying there, not just the panel. We have the Q&A box open. You can put your questions in there. There's the upvote function. So you can, if you see someone putting in like a question you like, feel free to hit the upvote on there so we know which ones to prioritize. We'll show the development credits at the end of the session, and we'll also be recording the session and sending out everything over email. Awesome. And so today's topic is about designing recognition and reward systems that reduce healthcare turnover. And so I just want to give a quick preview of the questions today. We really want to talk about what's working, what's not, and how we can design recognition initiatives and engagement initiatives to really support retention in healthcare. And so to help guide the discussion today, we've pulled together a few key questions based on what you lovely folks have submitted prior to the events. And let me tell you, it was so hard narrowing down the questions to make sure that we could finish everything in 1 hour. And so first, we want to explore retention through the employee lens. For example, signs of disengagement, what keeps people committed and motivated, and what it means for people to feel truly valued. We'll then move on into discussing how to create equitable recognition and engagement experiences across different teams and demographics because we're all unique and we all like to feel recognized and valued in different ways. And of course, we'll then end off the conversation talking about how to measure success. So it's a wide range of topics today, and we're looking forward to hearing from everyone and seeing what's working well and what you're seeing as well. All right. That's it for me for the beginning intro bits. Kaylee, I'll pass it off to you to kick off the fireside chat. I know we're all very keen to learn more about the panelists and where they're working, what their roles are. And so I know it's part of question one for the introduction, so I'll pass it off to you now.
Perfect. Well, why don't we hop on into it? Just before we get into kind of the thick of it, why don't we go around and just talk about, your organization, your role, and as a healthcare leader, what's actually keeping you up at night right now? Todd, I see you're off mute, so I'm going to pick on you.
Okay, sure. Todd Lyon, Vice President of People and Culture, Naples Comprehensive Health in Naples, Florida. We are a two hospital system, 715 beds, about 4,500 employees. We're the second largest employer in Collier County, Florida, after the Collier County Public Schools. We also have some freestanding emergency departments and about 40 offsite doctors' offices. So, in an age where a lot of healthcare systems are shutting down and doing layoffs, we're in a huge growth capacity. So we just built a huge orthopedic center. We're working on building a large cardiac center and then also a women and children's tower. And so with all that means that not only do we have our current positions, requisitions that are open, but we now need to get net new positions in addition to those. So what's keeping us up at night right now is staffing. So not only recruiting those people, but retaining them. Hence today's conversation. How do you not only attract the people that you need, but how do you keep them there? So I'm excited for today's conversation. I know the panelists are great, and hopefully we'll get some good questions.
All right, I can go next. Thank you, Todd. I'm Jenna Raycraft. I work at Lakewood Health System. We are a critical access hospital with a number of clinics in central Minnesota. We have about 1,000 team members with us, and I would say our primary mission here at Lakewood is to provide our rural communities with access to high quality patient care, starting from birth to end of life. We had over 500 babies born here last year, which is a lot for a rural hospital. Recently opened up a cancer center to provide radiation treatments to our community who previously would have to drive an hour or two to get those services that they have to access every day when you're going through something like that. I think from our lens, being a rural healthcare system, I would say Medicare, Medicaid costs, those cuts definitely keep us up at night. We have a lot of older people in our community and a lot of people in poverty in our community who rely on those funds. So that's one of the pieces. I would also say, similar to Todd, is staffing. How do you staff differently? I think of our clinics. LPN positions are really hard to get right now because it's so easy now to become an RN, which is great that we have those programs. How do you change things in the clinic to accommodate, the different trends in staffing? So, yes.
Oh, you're just on mute, Ralph.
Okay, now I'm back. Now I'm back. And I had such a great answer I was starting off with, so I'll start again. Um, Echoing much of what's already been said from Todd and Jenna, I lead the human resources effort for Lutheran Family Services in Nebraska. We're the largest nonprofit in Nebraska, providing behavioral health services to the state. And so one of the things that we're running into is a shortage of finding mental health practitioners to work in the field because there's stringent requirements, as you can imagine, to treat people with mental health issues. And so between having a shortage of people, having too many jobs, and then having a pretty comprehensive credentialing process to go through before the individual can become fully licensed, our focus is not only on attracting those folks, but making sure that we keep the individuals that we have. So, yeah, we have about 400 employees, and we're continuing to grow. So, to echo what Todd said, where there's been some reductions in the industry, we're continuing to expand services.
Amazing. Well, it's so great to have all of you guys on with us today. I'm so excited to get into the thick of it. So let's do this. So when we talk about retention, we often focus on, turnover rates. But what are the early signs that tell you employees might be disengaging before they actually leave your organization?
I can jump in on this one first. I think what I notice, I do pay attention to our engagement surveys, things along those lines. And when I start seeing individuals say that they have a lack of trust in the organization or with leaders or with the way things are being done, or that communication is not what they're looking for, things along those lines, that's a clear indicator to me that there's probably a lack of engagement. It stands to reason if I don't trust you, I'm not going to engage with you or engage with your organization or engage with the message. So when I see those metrics, that absolutely makes me question how things are being done. The other thing that we do in our organization are two down sessions where senior leaders will meet with their direct managers, employees. And when we hear things like, we're not getting this information, we haven't been told, we didn't know, things along those lines, we really begin to work on shoring up that communication practice because we know from experience that if employees aren't getting the information, then they'll assume, and that can also lead to a lack of trust and ultimately a lack of engagement.
Yeah, very true.
That was very well said, Ralph. And I think that we're doing our pulse survey now. So we do an annual survey, then we do a quick pulse survey, and it literally took me 3 minutes to do it. And there's room for comments, but I think that you have to keep that pulse, even though we're doing the annual and the pulse survey. I think it's up to the individual leaders tabs on their team, so to speak. You have to have huddles. You have to have one-on-ones. We have to be the proactive one to go to our teams and say, even if everything seems great and you've got an employee that comes in and seems wonderful every day, one of my favorite rounding questions is, what's going on that I should know that I don't know? Because that chatter starts out there and it's the water in the boiling pot, right? And you don't want it to boil over. So you take some of your employees that seem very content and they might say, well, things are good for me, but so and so over there has mentioned blah, blah, blah. And it's just going to be very eye-opening. And so to get in front of it, to try to be proactive instead of reactive, because sometimes once you've lost them, you've lost them. It's hard to bring them back. You've got to really try to get in front of it. And quite honestly, it's hard. We have busy days. We have to get through the grind of the day. It's hard to sometimes take that time to be proactive.
Yes, I would echo, everything that Todd and Ralph said. A little bit more with what Todd was saying too. I think looking at it from a strategic perspective of like, what systems do we have in place within your departments, within our teams, within our organization that are going to provide those checkpoints to notice when someone is starting to be disengaged? Like, does your team have a daily huddle? I think of our 30-day, 90-day, 6-month check-ins that we have built in as a system. That's an expectation of the leader. That's a great time to do those check-ins. Similar to these guys, we do an engagement survey every year, and we can identify trends like, okay, team members in that 3 to 5 year mark look like that's where they're starting to question their commitment to Lakewood. Is there something that we can do differently strategically, offering tuition assistance, offering growth pathways? But I think, like Todd said, being proactive rather than reactive, how do we build those structures in so that we can notice? Because if we're just going about our day to day, our nursing leader who has 50 nurses on her team isn't going to be able to see every single person, maybe even a given week. Right. So how does she have those touch points set up with her charge nurses? Where are those areas that we're going to notice that someone's starting to disengage?
And just to circle back to the initial point of this, it is, the turnover and retention rates are important to look at, but we will do that, right? We see that all of a sudden we're losing 3 or 4 nurses from one area and we investigate. But to what I was saying before, then you've already lost it. You can't bring them back. So it is important still to go in when that's happening and have the difficult conversations and ask the questions of the team that did remain. But again, it's just often too late at that point.
And I'm also very biased, I think, coming from the leadership development side of the world, where I feel like that's where we task our organization or myself with, how do I equip leaders to have those touch points? Like you said, like we look at the data, but how do we train leaders to notice these things?
Exactly. I think that's great. Now, when we're looking at retention, a lot of organizations still treat it as kind of this separate initiative from what they're currently doing. How do you guys think about designing a workforce experience that, actually keeps people engaged and committed long term so that you're not seeing those lagging indicators of attrition?
I can go first on this one. I think designing a workforce experience, it's similar, I feel like, to what I've said in the previous question is like, how do we build in those systems, whether it's those touch points, those reviews, those leader trainings, how do we share resources on like how to build an effective team, those team charters, team mission statements, that address the whole workforce experience and not just one piece of it. Not just equipping leaders to have good disciplinary discussions, but how do we equip them to create a place of welcoming and belonging within their teams? And then I do think as well, we use bucket lists at our organization, and it does create this community atmosphere around recognition right away, makes them feel like they're part of the Lakewood Club, where they're able to log in and see what's happening around the system. It's like, how do we get people to feel connected and belonging early on?
We similarly have a recognition platform as well. We just moved to one. It's called Wombi, and it's great. It's like Facebook for work, instead of personal. But people are giving each other messages and likes and just being part of that community. I think that one thing I always like to say is that we're just in a workforce now where just one size doesn't fit all. And we have to be very creative and think outside the box. It's kind of like, some people like that individual recognition. Other people want to be recognized in front of others. Others would rather just have a quick text message or a card. Um, I think we need to take the time to get to know our teams as individuals and know what makes them tick. So they really feel like they don't feel like they're for us just one of 4,500 employees. And maybe in people in culture, we can't make them, I can't learn everyone's names, but their individual leaders and supervisors can. And they can kind of learn more about them and make them really feel like they belong. The term culture gets thrown around all the time, but I think healthcare in a lot of organizations is kind of a culture of no, right? Like everything, we have to follow so many protocols and we have to follow so many things to get things right and standards and regulations, compliance. I think we need to find the things that we can be lenient on and can say yes to and try to leverage those and create more of a culture of yes and a culture of, I wouldn't say collaboration as much as consensus. So we're not always going to get to take everyone's ideas and use them, but if everyone can at least come to a similar conclusion or at least understand why we're doing things and bring them along for the ride instead of just dictating what's going to happen, that will create that stickiness, so to speak, that will help them feel a part of the organization. And then it's harder to leave because those are your coworkers, that's your team, that's you feel motivated by that and you don't want to just up and go. But these are all things that are not, if there's a silver bullet, we would all be doing it and we wouldn't have these issues. So that's why we have to have these discussions and kind of see this works here and this works there. How do we bring it together to find a good solution?
Absolutely.
Yeah. Yeah, I would say I would echo both of the comments. I would also say too, we've really taken over the past couple of years a strong stance that onboarding in our organization is a year-long event. We don't use orientation and onboarding interchangeably anymore. Orientation is the day that you come in and fill your paperwork out and all of those things. But onboarding has been built into our organization as a year-long event with multiple touch points. And so, yes, 30, 60, 90, 6-month reviews, annual reviews. We also do a 90-day coffee where all the new hires get together on teams and we come in and have senior leaders visit with them. While we call it the get to know ya. That's the name of it. And so we do all of these things over the course of the first year with multiple touch points, multiple intention points to ensure that by the end of that first year, to Todd's point, there's some stickiness there. I mean, Gallup cites every year that 70% of people leave their organizations because of the relationship they have with their managers. So that frontline manager leader relationship with their direct report is incredibly important. And so we're building into our culture that those touch points happen as a result of the employee experience and not just leaving them up to chance.
I love that. And that's so true. Like people truly don't leave a job, right? Especially if you're working in healthcare, maybe you are a nurse, you're going to another nursing role, and it's probably going to be very similar. You're probably trying to leave that manager or that leadership team that you are working with. Really quick as well, Todd, you've got some fans in the webinar chat here. A lot of people saying, the point that you made on, not leaving people in the dark is so true and it's resonating with a lot of people.
Yep, it is. And the hardest part about sharing the why, sometimes I see that comment in there are times behind closed doors where I meet with other senior leaders and we don't agree and we hash it out and we go back and forth. But you have to leave that room at least understanding the why and knowing, are you doing, like, we're a nonprofit, so are we doing what's right for the mission of our organization? It might not be the way that I would do things necessarily. And you have to go out as a unified front because that needs to trickle down to your mid-level managers and then it needs to trickle down to your frontline staff. If there's any sort of dissension in the ranks, so to speak, they sense it. I mean, people know, people are not dumb and they feel it and they sense it. And the minute they feel misalignment, they want to look for somewhere that's aligned.
Very true. Now, in any workplace, there's going to be different personalities, like you said, and you just have to learn how to get along and be on the same front. When we're looking at things like feeling valued, how do you actually make sure that all of your employees actually feel valued in a way that is actually meaningful for them across different, groups, different demographics, generations, that sort of thing?
I can start with that. We do as part of our onboarding process, we provide a form for everyone to fill out before they come into the organization to tell us, how do you like to be celebrated? How do you like to be recognized? Do you like a handwritten note? Do you like just a quick conversation, public praise, things along those lines? Favorite drink, all of those kinds of things as a way to help build rapport with that employee so that on day one, we have a little bit more information about them and what they like so that we can help, recognize them in a way that's meaningful to them. The other thing that we have really been working on with our managers on our leadership team is to be impeccable with their word on the small stuff. Trust is not always broken because of one big thing. It's usually a series of issues that leads to employees not trusting their managers or their team members or things along those lines. So if we can build a culture where people are being impeccable with their word on the small things and then recognizing if something big does occur, absolutely walk into that moment, own it, take accountability for it, say what you're going to do to fix it. That goes a long way with building that connection between the organization and the employees so that when something big does happen, it's not that one sort of catastrophic event that sends people packing. It's okay, this was a mistake. This is what they said they were going to do. And I trust that they'll do this because they've proven to me through a series of events leading up to this issue that they're impeccable with their word. And that's, I think, just really, really important, especially in today's environment where everything can be quickly forgotten, manipulated, all of that kind of stuff. Just being honest and transparent is just critical.
I'd like to piggyback on what you said, Ralph, about giving that format. That's a great idea. We've done that in our department, but we haven't done that like company wide, and that's a really great idea. I think that um, with every generation that comes along, and I know we have like 5 generations in the workforce now. So not only are we dealing with so many individual personalities, but then you've got the stereotypes of generations. And that's not to say that someone new in the workforce doesn't have that boomer mentality, but you never know kind of who you're going to get through the door. But I think it's extra work to get to know your employees as humans and not workers. And that's what people want. It used to be work-life balance, and you would go in and you'd clock in regardless of your role. You clock in, you clock out. Now, with some of the non-clinical roles having hybrid working, and even those that are clinical and need to be in, they're on Facebook groups with their coworkers, and they're going to know their coworkers in different ways. It's no longer that work-life balance, it's work-life integration. And so getting to know your employees as people has now become a core competency of leaders, which makes leadership even that more difficult because it is one of your core competencies now, as much as I hate to say it, to sometimes be the therapist, to sometimes be the teacher, to sometimes be, I mean, that's our role. So everyone thinks, ooh, I was a nurse. Now I'm be a nurse manager. Well, think twice because it's not just taking what you did. And there's this whole other aspect to it that quite frankly can be exhausting. And I'm sure that, with people on the webinar now, that sometimes you go home and you're like, wow, I just spent my entire day being a facilitator of whatever it is. But that's what people want and they feel it. So even though you have those exhausting days, think, what, today was exhausting because I was the counselor to my current team, but it probably saved me from having 3 of them leave and I have to go recruit for new people for those roles. But it's just part of what you do and it's part of what people want, I find.
Yeah, I agree with both of the answers. I think, seeing people as people, like Todd said, I think making people feel valued or helping them feel valued, realizing that everyone feels that differently, but I think there is some universal pathways to it. Like when people are walking down the hallway, do we say hello? Do we know people's names who we see frequently? Do we ask a genuine question? Or is it just always, how are you? Good, good. Okay, moving on. I think just taking a moment to pause throughout our day to actually check in with individuals makes people feel valued. I also think from a system level, fair wages make people feel valued. It's looking at the whole employee experience. Work-life balance makes people feel valued. So I think all of those pieces come together. I heard a method too in the power of mattering. It's called the NAN method. Like when we're affirming people, The first piece is notice. Like, do we notice an action that they did, a specific action, affirming that action? So telling them, hey, thank you so much for providing that great patient care. You really calmed, that toddler down when they were starting to lose it on the weight machine, and you just did that so gracefully. And then the last one is needed. How do we tie in how that person's unique action is needed on our team? I'm so glad that we have you and just your patience and your graciousness with young children, because it really makes us better as a clinic team. So just trying to see those unique values that people bring and tell them that. Don't just say it behind closed doors, like tell them.
Yeah, I would echo that both comments. So I'll give you a quick example. So we all have our bucket list items, and one of mine was to write a book. So I wrote a book this past year, and it was so interesting because having my peers come up to me and say, "Oh my gosh, I didn't know you did this," and talk to me like a human being and not in my role. It First of all, it freaked me out a little bit. And second of all, it felt good to have that connection, that conversation, with people being treated as a person and not as your role. And I think sometimes a lot of my time in coaching with leaders, I have to remind them you're a person too. And if you want people to interact, build trust, create relationships, you need to take an effort and make an effort to do that. And it just that dawned on me when Todd said, you sometimes come home and you feel like all I did was facilitate or talk to people or all day long, and and it's like, yeah, I did, but you don't know the impact that those conversations are going to have and the way it's going to leave people and how they're going to feel about it. So it's just those touch points, they matter. They absolutely matter.
Such great points, both of you. And Jenna, getting to your point about when you say just someone, oh, how are you? We're taught to just say, oh, I'm good. Even when you're not good, you're taught to say good, especially at work, right? Unless something, sometimes people are honest if they're comfortable enough. One activity we use, and we had a guest speaker that brought this in, and we kind of did in the organization a little bit, but we do it a lot in our people and culture department, is we check battery levels, right? Everyone's got their wireless device. And you know that if you're at 100%, it's great. But when you get down to like that 2010, it's a little bit of panic mode. But all of us have battery levels too. Like today, I'm feeling pretty good, right? Like I'm also off tomorrow, so that helps a little bit knowing I have a long weekend. But like my battery level's like at an 80. But some mornings I wake up and I know I've got a huge day ahead and I might have some anxiety and I might be like at a 30 or 40. So instead of just saying, oh, how are you? I like to go around and say, how's your battery level? And it opens a conversation to say, I'm about a 40. Oh, why? What's wrong? What can we help you with? It also helps the coworkers know I'm at an 80, they're at a 30. They need some of that extra attention today. And it might flip tomorrow, but it's a better way instead of just saying, how are you? Because we are conditioned just to say, I'm good, I'm fine, no problems. And that's not always true.
Absolutely. Now, we've had some really great comments in the chat, but does anyone want to come off mute and maybe ask any of the panelists a follow-up question, or I mean, even sound off what their battery levels are at?
I'll say something real quick, Becca here. I love that reframing of the question, Todd, because to the point, the how are you? It's such a societally ingrained question that we're so used to answering a certain way. And so just putting it in like a different phrasing, a different format, different like possible answers, I think that's just such a smart way of doing it. Like it's another set of questions that we can keep in our toolbox to ask people who are really trying to get down to the nitty-gritty of it all. So thank you for sharing that strategy.
Absolutely. We're no longer
Absolutely.
in that stoic generation of everything needs to be fine. People are vulnerable. I mean, we've all been through COVID together. I mean, what could possibly, I mean, there are things that could be worse, unfortunately, but I mean, that was huge. And we as a nation and world had to go through that together. People have been willing to be a little bit more vulnerable. And and in a way, why not leverage that? That's a great thing that you can actually learn to get to know your team. Because again, the more you get to know them on an individual basis without crossing boundaries, if they're not comfortable and they don't want to, that's fine. But I will say that I found people in the workforce since COVID, probably even before that a little bit, are more willing to share things. And if they're willing to share it and it's appropriate to share at work, Get to know them on that level and don't be fake about it because everyone can see the fake right away. But get to know them and what do you have in common. And that's what builds the relationships and the bonds and the culture. That's what will help with retention. Getting to know them as a person and also to commend what they do and celebrate the wins. We do not spend enough time ever celebrating the wins. I back from my theater days, I remember in dress rehearsals, they used to say, so much of what you did in that dress rehearsal was so great that if we focused on that, we would have too much to talk about. So all we're going to do is talk about what's not working. It's the same thing we do in the work world. How many times do you go into a meeting and say, we did these 7 things amazingly and we need to work on this thing? No, you start with this didn't work. So people want to work on a winning team. People want to be commended for what they're doing well. But sandwich it. You've still got that work to do in the middle, but celebrate the wins. People want that.
Exactly. Scrolling back here, Etienne said, biggest reframe is that getting to know people is now an investment with big returns. We're so used to doing the work tasks and seeing this as such a big value add. Which, yeah, absolutely. It used to be you go to work, you do your job, you go home. Now we're starting to bring that human in as a third space, which is incredible. And then Azul, I hope I'm pronouncing that right. I'm going phonetically here. I also said we have a give a shout out channel on our internal communications platform, which is a great way to bring visibility to how specific actions and contributions help the entire team. It's also available to all team members, so we can own recognition and contribute to making everyone feel special. Which does kind of lead us into our next question, which is, when we have all these different generations, different departments, people who maybe we aren't going to see, going across the hall with each other, how do you make sure that recognition and engagement activities still feel equitable across, your frontline teams, across different shifts, departments, and then care settings?
I'll start. I think you have to go out of your way in healthcare to remember the non-clinical team members. I think there's so much emphasis when you say like, oh, I work at a hospital, people think doctors and nurses. And then they might also think then pharmacists and respiratory therapists and physical therapists. I think so often the IT folks, the finance people that do our billing, the human resources, all those people sometimes get left behind. And clinical is obviously incredibly crucial and we need them, but it's remembering that we have different types of jobs, different ages and different jobs, different people. Um, so I would just encourage to always, anytime you're going to do an initiative, for instance, we used to just have Nurses Week, and we did keep some certain things on Nurses Week, but we also celebrate Healthcare Week. And so we want everyone that works at the hospital to feel important. When we go to give increases, we don't just look at clinical positions. We look at the overall scope of the practice because we all need to be there. So again, it's taking that extra step to look at what your geography kind of looks like and ensuring that everyone feels included, as difficult as that can be.
And I think similar to us, having multiple shifts, multiple campuses, just when we're thinking about Healthcare Week, we do that as well. We celebrate that week. It's like we offer a free employee meal. How do we ensure that our satellite clinics get that meal? How do we ensure that our overnight staff get that meal? I also think for us, that was another big reason why we implemented the bucket list program here at Lakewood. Previously, we used to do like a paper shout outs. There were cards you could fill out, give to your manager, they turn into HR. It gets delivered to that individual. How those are distributed was, varied widely depending on the department. But some of those team members, like satellite clinics, overnight team members, our remote billers and coders, like very key people to our system would often get missed. And I think that's what we love about this program is once you've been here for a week, I think, well, really once you start, you get a profile where you're able to recognize anyone in the system. You can just look at your team and see who's within your team, but it gives people the opportunity to recognize across departments as well as for leaders to catch individuals within their teams who they might not see as often, to be able to recognize them. And regardless of if you're a casual team member or you're a doctor, at Lakewood, everybody has a bucket list account to be able to recognize one another.
Yeah, I would say, echoing what's been said, our organization is 400 people, so we have an opportunity to still um, maybe not have personal relationships with everyone, but at least know everyone in the organization or know who they are and where they work. I would say generationally, we have multiple generations working in our organization because we do invite people who have left the workforce to come back if they want to work after retirement. And the one thing that I have found with everyone, and it sounds overused, but you have to stay curious with people. You have to, when you're inviting them in, when you're doing the interview, instead of just trying to bum rush them through the interview so you can get a position filled, and we've all been there and we know that that happens. You want to make sure that you're really working to develop rapport, ask those questions. You know, if someone's coming back into the workforce, well, what brought you back into the workforce? What are you looking to do? How do you like to be recognized? I know that my older workers, they still like to see things in physical format. They still want the memo. They still want something that's tangible to them. How can I meet that need? I know my younger generations want to see things in text format or want to see things with, a quick way to get the information and, have the ability to follow up if they have questions. I think sometimes we forget, and I think maybe Todd said this earlier, it's not a one size fits all approach anymore. And the only way you're going to know how to connect with the employees is to really lean in and do things like this. Have conversations with them, face-to-face conversations, and recognize that that's your opportunity to build the relationship. And a lot of the onus is on you as the employer to do that, especially if you're looking to engage and retain, and we all are looking to do that. So I think really that investment up front during the interview when they're thinking about joining the organization is the best time to begin that process and learning about them and diving into that. It may be the case that that person that you're interviewing doesn't take the job or like the job, but if they have a meaningful, wonderful experience with you and you take the time to get to know them, they will tell somebody about it. They'll tell somebody about what a great experience they had. Maybe it's a friend, a neighbor, whomever, and people will come to you. And our community, we've seen that. I don't know that that would be the case for everyone, but we've seen that positive word of mouth happen.
Ralph, to your point, it's so tricky in healthcare because think of every person we don't hire or everyone that leaves our organization, we still want them to come see us as providers. So it's not just we're saying we can't hire you and have you be employed by us. We
Yes.
still need their business. So it's that
Yes.
double-edged sword. And so you're right, we always need to be on and making sure that we're leaving good impressions. And, one thing that we're about to implement is probably not for the folks that left, involuntarily or had issues, but we're about to start an alumni campaign for people that have
Mm.
left Naples Comprehensive Health. It's not going to be incredibly invasive, but we're going to ask when they leave voluntarily if they're interested in receiving our quarterly newsletter. And what we're going to do in there purposefully is say, hey, we just increased rates and gave market increases to these people. We just added this great new benefit of parental leave. We just did this, so when they see that, they might think, oh, I went to work for the competition. Now, what we'll also do is people that maybe move out of state and don't have the opportunity, it will keep them informed of what we're doing
Engaged.
to keep a engaged and keep a positive word of mouth about the organization. Wow, they cared about me. Like I don't work for them anymore, but it wasn't like they don't care. I'm still engaged. I know what's happening there. And that's really a minimal spend for what you can get back on the return. And it's a great marketing and advertising mechanism. So we actually are just starting that this coming quarter, which is pretty exciting.
Yeah, I
Very
love those.
exciting.
Great idea.
Well, and you've got to love boomerang employees, right? They're people who already know your organizations. Maybe they left because there wasn't a growth opportunity or something along those lines, but what a great way to keep them up to date on what's happening and get them to come back.
And when they come back, get testimonials from them because it's some of the best marketing. The grass is not always greener. There are some of your people that will give you the best and will tell their coworkers, listen, I went to the competition. It's not what it was made out to be, and I'm back. They're some of your most loyal folks.
I believe it. It looks like Jill actually in our chat has already launched an alumni program. Jill, I don't know if you're willing to share a little bit more, but I'm sure we'd love to hear it if it's been successful or if you've had any boomerang employees come back from that. We also don't want to pick on you if you don't want to come off of the mute or anything along those lines. Hi, Jill.
Just enabled the permit to talk, but no pressure. Oh, let me see. I can. Okay, it says talking permitted. Let me know if that. I think you have to hit unmute on your own end as well, Jill. All good. Should be working now. But if not, no worries.
Oh, maybe not.
Oh, sorry about that,
Oh.
Jill.
All right. Well, we tried. Jill, if you want to share in the comments, I'm sure again, we'd still love to hear it. But Etienne said, despite how hard folks work as consultants at McKinsey, employee who leaves are brand ambassadors for the company. So they've been doing this right for a long time. Very, very true. Well, that does kind of lead us into our next question, which is we work in these very high pressure environments. So healthcare employees are constantly facing, the change that you guys mentioned in your introductions, staffing pressures, documentation requirements, evolving regulations. How do we build something that, isn't just equitable, but also consistent across the board as well?
I feel like I touched on this a little bit with the last one, but I think that, I mean, we've had this program implemented now for probably 3 or 4 years, and it routinely shows up in all of our focus groups that we do with team members, in our engagement surveys. I think having this platform has really enabled recognition to grow at Lakewood. I also think I was just chewing on this as well as we were all talking. All of us probably, or a lot of us on this call are, we're people. Like we're in the people business. We enjoy working with people. It's not hard for me to make a connection with someone. Like I enjoy it. I have fun, getting to know lots of different people, even if I can tell someone might not like me very much. It's like I just enjoy it. That's how I'm wired. We have a lot of, leaders within our team who aren't wired like that. They're more introverted, they're more analytical, and not to say that you can't still value people and have that personality. But I know, like, for example, my husband, we're complete opposites. He's an ISTJ, he's in finance, he loves Excel, he's hilarious. And I think of programs that we have in place here at Lakewood that like enable him, that give him that opportunity where that's not going to be his natural bent, is to like go up to someone and just have a full-on chat about their weekend and how they're feeling and how they're doing on the team. I think that sometimes as organizations, we have to build in those pulses and we have to build in those opportunities for those connections to happen. And I think Bucket List does that for us, and it creates that consistency. And I think it creates that opportunity. Every leader gets a bank of points that they can award to their team members. So like make it easy for people to recognize one another, make it easy for recognition to happen.
Agree with you, Jenna. I think we need to stop thinking of like the individual conversations and the rounding and the huddles and the getting to know people as kind of interrupters to our job, and to start realizing that is our job. I know I've had staff that are like, oh, I can't get anything done because the phone just keeps ringing off the hook. And I'm like, yeah, but our job is to answer those questions for those employees. So it feels like interrupters. We need to kind of change that mentality that that's our job. And especially as leaders, there are those times where you go to work and we've all got our to-do list and we don't get to any of it. We might get to two things and we feel successful. Um, And so there's the piece of recognizing people as individuals, and then we talk about like other recognition, to have those recognition programs. Not everything can be financial, but what you find is a lot of people don't need it to be. Like on our social platform, so to speak, with Wombi, people love to go on and like and see what's going on and happening. I mean, money's great, and we have some of those initiatives as well, and even low dollar amounts. I'm talking like, 50 or $100. Everyone can does something, their names go in a hat, and one person wins. But the non-financial things often mean just as much as the financial things.
Yeah, I would completely agree with both comments. So, for me, I would say that I'm kind of an omnivert. I can toggle between being an introvert and an extrovert, and so it is difficult for me on some days to lead HR efforts. But when you recognize that the one conversation, the one interaction, the one thank you note you may write, the one minute you may take with somebody who says, hey, yeah, my battery's low. I'm struggling a little bit. All the difference in the world. And it's those kinds of things that have the greatest impact on people. And I think consistency across the organization, to the point that was made, some days you only get two of those things done, but you don't realize that, the rest of the day, you are really impacting people's lives. I mean, I tell my team all the time, the individuals in the organization, the employees, those are our customers. So we're not serving people directly, but we're serving people who are serving our customers, our clients. And in order to ensure that we're giving the best possible service to our clients, we need to make sure we show up for our employees. And that's done through consistency, it's done through interaction, and it's done through trust. And I just don't think you can go wrong with those three things, especially if you're doing it with true intention. We've talked a lot about, it can't be fake. People will pick that up. They do. So if you're truly, going at it from a place of good, yeah, not everyone's gonna, pick up what you're putting down that day. That's okay. They'll remember it though, and they'll come back one of those days, and they'll be more inclined to have a conversation with you because you took the effort, at one point, or you made the effort to connect with them at one point. So, yeah.
Ralph, it's so true. You just said about trust. Again, it's kind of like, I was talking about when people aren't engaged anymore once you lose them, if you lost them. If you lose
Hmm.
their trust, it's gone. So
Hmm.
often in healthcare, things are moving so quickly. I think it's really hard, especially sometimes in C-suites, for everyone to kind of take a breath and really make sure that the messaging is correct instead of just immediately throwing something out that may even have like one little thing in it that isn't correct. People hold on to that. So
Absolutely.
you really have to make sure that when you message, even if the message is, we're not going to have an answer to you for another week, or unfortunately, we aren't able to give increases this year.
Hmm.
It's hard to give that message, but transparency is playing the long game, right? The immediate message is not always wonderful, but they'll know, you know what, when my leadership talks to me, I know that what they're saying is going to happen.
Yep, absolutely.
Well, when we're looking at recognition, managers don't see everything at all times, unfortunately, as much as we wish they had eyes on all the sides of their heads. Have you guys had any success with things like peer-to-peer recognition?
I'll just start one of the initiatives we have. We have a above and beyond award, and it started in just the clinical areas. Then we realized we really need to do this for the whole group. But our employees nominate with a story, and then we take 3 to 4 stories a quarter, and we do one specifically for our inpatient and then one for our ambulatory. And we list the stories without names. We redact any information that could identify who it is or what department. And then all employees are able to vote, and the winner gets $1,000. And we get one of those big checks you get, like when, like that, it's a fake check, obviously. But we get photos with that. It means the world to people. I mean, that is a decent amount of money. But um, the fact that even if they were nominated but didn't get it, they still love it because it means someone on my team noticed that. And 9 times out of 10, because managers can also submit, 9 times out of 10, it's a coworker, it's not the leader. And they're like, wow, my coworkers thought that about me. That's amazing. So, I mean, when you look at an organization, it's $8,000 a year. I mean, really, that's such a drop in the bucket for all the photos and publicity and everyone to say, "Oh my gosh, are the nominees out yet? When are the nominations coming out? When is the award?" So, I think that's it's great to see them recognize each other. It often means more than when your leader recognizes you.
Yeah, we do something similar. We call them star awards. And yes, it's mostly peer-to-peer nominations. Also, if a patient calls, we include those, redact, of course, any PHI, anything like that, HIPAA related. But they submit that along with the story. They pick typically three, I want to say around three a month, and our CEO shows up, big balloons, their manager, whoever nominated them. And then they receive 1,000 bucket list points, which is equivalent to $100. So, not as I love the big check though. That is so fun. I would definitely do that, Todd. But yeah, there's 3 to 4 a month, and then those nominations get put into a grouping for team member of the year. So one of our Star Award recipients gets that bigger recognition during Healthcare System Week. And then in our recognition program in Bucket List, that's mostly where that recognition is coming from, is peer-to-peer. Everybody gets a login, everybody gets a bank of points. The number of points varies depending on your FTE. And you can recognize people without points. You don't have to use the point system. But what's great about it is then as you rack up those points from recognitions that you receive, and it could be from someone in a completely different department, different leader, lots of different things, then you can hop into the redeem space and redeem something that you want. Lakewood swag has like exploded around here because of it. Everybody wants something Lakewood branded, gift cards, things like that.
Yeah, we have the similar, almost the exact same program here. We call it the Inspire Awards. Follows a very similar format to what's been mentioned here. Because we're a nonprofit, we don't give out the cash awards, but we do give out awards to our swag store. And you would think that I'm giving people gold bars when I give them stuff from swag. It's meaningful to them, and it's fantastic to reward people or recognize people based on something that's meaningful. So based on what was said earlier, it's not always cash. It's the environment that you're creating around what you're celebrating daily. I think if we offered cash now, well, our funders would frown on it, but I think people would be like, you don't need to do this. We're great with the swag because it's meaningful to us. So yeah.
I think along with that too, just I don't know, slightly funny story is we saw a significant increase in compliance in our benefits plan for how many of our team members on the plan would get an annual preventative exam. We used to offer $1,000 to their HSA, which we still just give them now. They don't have to complete the exam, you just get it. But we changed it to say if you get your exam and submit a form that you did it, we'll award you 1,000 bucket list points. And we put on a bunch of like on cloud shoes, typically $160 shoes that they can redeem for 1,000 points. Our compliance for our plan shot up because people could get cool shoes.
Mhm.
So it's just interesting, those behavioral economics as well. What
Mhm.
motivates people, like Todd
Mhm.
and Ralph has said, it's not always financial.
No, no, it's not. This is the most ridiculous thing I've ever done, and it was like some sort of weird thing that people competed over. I went to this novelty store here in town. It was called Oriental Trading Company, and they had these little plushy stars that said "You're a star." So immediately, if you recognized people or whatever, I got a couple of boxes of these, thinking, "Oh, these will be fun to give out." People hung them up in their cubes. It became like, these little badges of recognition. And when we ran out, I'm like, "Oh, sorry, we ran out." It was, "Well, when are you going to replace them? Because we want more," because it became this really cool competition of how many people could get. So, I mean, the cubes got a little cluttered, but it was fun. I mean, it was fun. And so, yeah, you just never know what's going to take off and what's going to motivate people. Yeah.
We gave last year for our Mental Health Awareness Month, not this May, but the May before. We gave away the stress balls,
Yeah.
and people loved them. So when we rounded, you like to give them something, and you don't always just want to give candy, you want it to be healthy, whatever. And it's not always food. So it's like, what can we bring? And so the team bought them, and I thought, stress balls. The
Mhm.
most popular thing. It was like it was crazy. And I think anytime you can gamify things, I think people love it and it makes them feel again part of the team. If you can do one team against another team in a healthy, productive way, so they're not feeling like, it's still positive, but gamify
Mhm.
it, right? Clutter your
Yep.
cubicles with it. Who gets the most? It's like getting
Yep.
badges in the or things in the different platforms. Like Jenna has that platform. The more you can get, the more likes, the more whatever. It's people love that. And that
Hmm.
creates the feeling of belonging.
Hmm. It's like a big warm hug. It
Yep,
really is.
exactly.
Yeah.
Amazing. I love that. I think it's really just about making it fun for people again, right? Like breaking up that monotony.
Yep,
And
absolutely.
making them feel special. People want to feel special. They want to know they matter.
Yeah, they want to be seen.
Yeah.
Exactly. All right. Well, before we start to close this off, anyone want to come off mute? Any questions for the panelists? All right, Becca, why don't we hand it on over to you?
Amazing. Thank you for such a great discussion panel. I also really loved all the comments that people were posting in chat. Very thoughtful, got paragraphs. It takes a lot of like effort. So thank you so much to everyone who participated with us and had this discussion. Wrap up, I just wanted to share a little quick thing about bucket list and then also do the professional development credits. So those are only two things on the agenda left. Kaylee, I'll let you share a little bit more about bucket list.
Yeah, for sure. It's kind of my day job, so I guess I can probably do that for us, eh? Bucket List is a peer-to-peer manager to employee-led recognition system. So if you liked what Jenna said about some of the initiatives that she runs, she does actually use Bucket List. So we'd be happy to share a little bit more. And I'm sure Jenna, you'd probably